Good evening, ladies and gentlemen, and welcome to another session of Charmaine's Total Wellness. Please relax as they stimulate your brain cells with a wealth of information.
Sexual dysfunction, according to Sadok and Sadok 2008, can manifest itself at any point in the sexual response cycle. It keeps an individual from getting pleasure out of sexual activities. The excitement phase of the sexual response cycle include both desire and arousal. So it is crucial to remember that women don't often go through these stages in the same sequence. Sexual dysfunction can affect any age, whether you're a male or female, even though it is more common among those over 40 because it's often related to a decline in health associated with aging. In general, there are 4 types of sexual dysfunction: lack of sexual arousal, arousal disorder, orgasmic disorder, and pain during sexual intercourse, namely dysphoria, according to the American Psychiatric Association. The etiology of sexual dysfunction, according to Sadok and Sadok, can be caused by a variety of factors. Such factors including physical or psychological, which is primary and secondary. The physical issue of sexual function can be caused by trauma, medical diseases such as heart disease and diabetes, even alcohol and drug misuse. So furthermore, the side effects of these medication can cause some sexual dysfunction, like antidepressants. For the psychological aspect, it can be work-related stress, anxiety, concern about sexual performance in a relationship or a marital relationship, feelings of guilt, concerns about body image, and the effects of previous sexual experience can also be a factor from the psychological aspect. The diagnosis and symptoms of sexual dysfunction. According to DSM-5, in males, you have erectile disorder, premature ejaculation, hypoactivity sexual disorder, and sexually induced sexual dysfunctions. In female, it can be a pain disorder, sexual interest arousal disorder, orgasmic disorder, and also substance-induced sexual dysfunction. In treatment for sexual dysfunction, some of the best known treatments are medication and mechanical aids. These mechanical aids include vacuum devices and pineal rings. You have natural herbs such as the chili powder, the yin and yang Chinese herb, and the mandrakes, which is an aphrodisiac, which is also mentioned in the Bible. You have sex therapy, behavioral treatment, psychotherapy, education, and communication, according to said American Psychiatric Association. So with all these in mind, an individual's success in sexual dysfunction treatment is determined by the underlying cause of the problem. The epidemiological aspect, or the assessment and the prevalences of sexual dysfunction. Many epidemiological data varies widely due to different methods of sampling. Sexual dysfunctions are highly prevalent, affecting about 43% of women and 31% of men. Hypoactivity sexual disorder has been reported in approximately 30% of women and 15% of men in a population-based study conducted by Lungeman in Sweden, and it is linked to a number of medical and psychological factors. Erectile dysfunction in male and female arousal disorder in women are present at 10 to 20%, respectively. In a study at the University Hospital of Jamaica in 2014, conducted by Ho, stated that sexual dysfunction among patients with end-stage renal disease was prevalent in males and females, with a total of 160 males and 102 females in this case study. Association exists between the sexual dysfunction and diabetes and also anemia. The findings also state that Jamaican men with hypertension is highly prevalent, and it increased with the duration of the illness, the age, and social demographics. The prevalence rate is 64% in Jamaican men, which underscore the need for control to treat the progression of this condition. Intervention of sexual dysfunction. It is crucial to remember that most sexual disorder is temporary. They occur for a short length of time in a certain setting with specific partner and eventually fade away with or without the assistance of therapy. But therapy, such as sex therapy, is a strategy for the improvement of sexual function and treatment of sexual dysfunction, along with the cognitive sexual therapy, which is a type of cognitive behavioral integrative with psychotherapy that focuses on addressing SDs by connecting evidence-based clinical intervention to scientific understanding. According to the CST, faculty sexual cognition, together with the misrepresentation of sexual need, have a direct impact on emotional, psychological, and behavioral control in sexual circumstances. To support the learning of sexual skills and the development of better appropriate sexual repertoire, it is necessary to reconstruct central and intermediate cognitive process. An advantage of using this therapy, and a disadvantage as well, is although that CBST does not address the neurovascular process involved in erectile dysfunction, it does aid in the treatment of psychological correlates and antecedents and consequences of erectile dysfunction. According to Kang 2019, Sexual Dysfunction and the Caribbean Perspective. Sexual behavior is particularly open to cultural and social influences. Culture affects sexual behavior and attitudes and expectation. Hence, sexual problems in different cultures vary. Many individuals in the Caribbean do not seek psychiatric help for their sexual problem since it's taboo and the culture prohibits it. Some persons are just overburdened by their responsibility and putting sexual dysfunctions at the base of their priority lists. Many insurance policies in the Caribbean do not cover these diagnoses, therefore some people cannot afford the therapy. Some people may not believe their situation can be resolved, while others are unsure to seek assistance. Some people are too ashamed to talk about their sexual experience, especially if it has to do with like sexual molestation or intrafamilial abuse as a child or adolescent. While the incidence in men is easily identifiable, women mask the dysfunction and go through a relationship keeping it a secret without ever getting help because of embarrassment. In Jamaica, however, there are myriads of treatments available. In a recent interview conducted by the Jamaica Observer, Dr. Carpenter states that people can receive help for free from Sexologist Research Clinic at the University Hospital. The clinic is open every Friday by appointment through the Caribbean Sexuality Research Institute office. In a biblical perspective, in 1 Kings 1 verses 1 to 47, in this chapter it is stated that King David was old and that he couldn't get warm, so David suggested that his servants find him a young virgin to keep him warm. They eventually sent for the virgin. However, she was very beautiful and she became the king's attendant. Being the fact that David was implied as a great ladies' man, he was feeble in his days and impotent. This kind of ridicule is consistent with the genre of this Bible verse. Even though it is unacceptable in many quarters of today's civil society to make fun of people's advanced age and their sexual dysfunction.
According to Elizabeth Plumtree 2021, boys who are assigned male gender at birth exhibit femininity living with gender dysphoria. Therefore, they are disengaged as it relates to masculine games, they disassociate with rough play and manual labor. They describe their genitals repulsively and repeatedly express their desire for their preferred gender, who's 2019. Adults with gender dysphoria experiences the same unease with physical characteristics and gender expectations. Their conviction is more dominant towards their gender identity. They are more aware that their gender conformity differs from their true nature and are more peaceful with the roles and characteristics of their desired gender, Plumtree 2019. Adults experiencing GD cognition are geared towards getting rid of all physical characteristics associated with their assigned gender, Murphy 2019. The etiology of gender dysphoria remain unclear. However, studies have
Policies in the
suggested
Caribbean do not cover these diagnoses, therefore some people cannot afford the therapy. Some people may not believe their situation can be resolved, while others are unsure to seek assistance. Some people are too ashamed to talk about their sexual experience, especially if it has to do with like sexual molestation or intrafamilial abuse as a child or adolescent. While the incidence in men is easily identifiable, women mask the dysfunction and go through a relationship keeping it a secret without ever getting help because of embarrassment. In Jamaica, however, there are a myriad of treatments available. In a recent interview conducted by the Jamaica Observer, Dr. Carpenter states that people can receive help for free from sexologist research clinic at the University Hospital. The clinic is open every Friday by appointment through the Caribbean Sexuality Research Institute office. In a biblical perspective, in 1 Kings 1 verses 1 to 47, in this chapter it is stated that King David was old and that he couldn't get warm, so David suggested that his servants find him a young virgin to keep him warm. They eventually sent for the virgin. However, she was very beautiful and she became the king's attendant. Being the fact that David was implied as a great ladies' man, he was feeble in his days and impotent. This kind of ridicule is consistent with the genre of this Bible verse. Even though it is unacceptable in many quarters of today's civil society to make fun of people's advanced age and their sexual dysfunction.
According to Elizabeth Plumtree 2021, boys who are assigned male gender at birth exhibit femininity living with gender dysphoria. Therefore, they are disengaged as it relates to masculine games, they disassociate with rough play and manual labor. They describe their genitals repulsively and repeatedly express their desire for their preferred gender, who's 2019. Adults with gender dysphoria experiences the same unease with physical characteristics and gender expectations. Their conviction is more dominant towards their gender identity. They are more aware that their gender conformity differs from their true nature and are more peaceful with the roles and characteristics of their desired gender, Plumtree 2019. Adults experiencing GD cognition are geared towards getting rid of all physical characteristics associated with their assigned gender, Murphy 2019. The etiology of gender dysphoria remain unclear. However, studies have suggested it originates from complex biopsychosocial links, Jorg et al. 2021. Numerous unrelated factors may contribute to GD, such as hormone influences during prenatal development, and environmental factors may also be involved. Maleness and masculinity depend on fetal and prenatal androgen. Sex steroids influence the expression of sexual behavior in mature men and women. Testosterone affects neurons in the brain that contribute to the masculinization of the brain in areas such as the hypothalamus. The epidemiological assessment. According to a sex health study published in 2017, prevalence of GD is remarkably high from 0.5% to 1.3% for self-reported transgender identity in children, adolescents, and adults. Traditionally, it was an uncommon diagnosis. Recently, the numbers have increased. The proposed treatment for gender dysphoria. Psychotherapy is a counseling technique utilized by therapists in helping patients to eliminate and manage troubling symptoms. Cognitive behavior therapy, or CBT, can be used to assist gender dysphoria people to identify and change cognitive and behavioral patterns that are harmful and ineffective. And this is done by replacing them with more accurate thoughts and functional behavior, increasing their well-being. Play therapy is helpful for children as it allows them to express their thoughts and emotions. Medical treatment for gender dysphoria include hormone therapy, which can aid in the lessening or resolving feeling of GD. Masculinization entails the abnormal development of male secondary characteristics in a female. This includes the growth of facial hair, fat distribution, and muscle mass, Murphy 2019. Psychologically, these procedures require suppression of endogenous androgens and the addition of estrogens, Spec 2016. Surgical intervention for male gender identity expression. Affirming medical procedure is an extreme or more extensive body modification. It helps the individual outward presentation with their internal gender identity. Surgical procedure includes removal of their breast, hysterectomy, vaginectomy, urethra repositioning, nipples reductions, Murphy 2019. Surgical intervention for female gender expression. This includes testes removal, thyroid and cartilage reduction, penectomy, mammoplastic, lip enlargement, and jaw and chin reshaping, Murphy 2019. Advantages of treatment in transgender. Transgender male and female seeking treatment can face 4 possible outcomes after treatment. It might be managed with intermittent cross-gender behavior such as cross-dressing. Treatment also can be resolved in favor of birth sex. It might be resolved by choosing to fully adopt their preferred gender over their birth gender, which is a medical reassignment. So the disadvantage of treatment for gender dysphoria people or the gender dysphoria issue might not be unresolved. So the Jamaican/Caribbean perspective on gender dysphoria. Gender dysphoria and transgenderism is uncharted territory in the Caribbean. However, they are more visible in Jamaica now more than ever. So Jamaica is a highly religious and homophobic island. In 2014, 25,000 evangelicals community organized conferences and protested surrounding positive ends by the Most Honorable Portia Simpson Miller to overturn the Buggery Law. U.S. State Department report in 2013, the prevalence of homophobic behavior and gender dysphoria is perpetuated by the songs and behaviors from musicians in the dancehall fraternity. These songs instigate violent behavior towards the LGBT community, which incorporates their family as well. White et al. 2016. So transgender in Jamaica are often ridiculed, discriminated by medical profession and even the civil society and citizens as well. Because of the verbally, emotionally, and physically abuse that gender dysphoria individuals often face, it impedes them from exercising their rights to health care and social events. The Marker 2018. A survey done by Biological and Behavioral Surveillance Survey conducted in 2018 by the University of San Francisco, it indicates that 51% of transgender women are living with HIV, UNAIDS 2021. Their unemployment rate in that community is 50%, and 1 out of every 10 sell sex to survive. A transgender report from TransWave 2021 indicates 50% have been physically abused and 20% report sexually assault, and another 80% undergo verbal abuse. So transgender individuals are normally chased out of their community, and this destroys the family structure. And so the family structure is highly variable in Jamaica. However, one's family is the structure for social and economical support. Disclosure of transgenderism relative can lead to social disintegration, stigma, ridicule, and threats. White et al. 2016. In recent years, families have lost their home by arsenal because of a family member identifying as gender dysphoria. Loss of income is also a big factor, and some have also been killed and raped. Country Information and Guide 2015. So according to Anderson 2016, the terminology gender dysphoria must never be supported by a secular worldview, but it must be viewed through the lens of the Christian worldview, presenting biblical perspective on God, creation, revelation, human nature, moral laws, the fallenness of this world, and what God has done and is still doing to redeem this falling world. Anderson 2016. So in Genesis 1:28 to 27 indicates God created mankind in his own likeness and image. He created male and female. The first couple was Adam and Eve, a male and a female. And this was basically done because of the reproduction process. So the intention of the Lord was for mankind in a family setting to reproduce